Hello dear listeners, I am Dr. Rajiv Karnik from Mumbai. I was very pleased to attend this World Congress of Cardiology 2023 at Grand Hyatt. I had two topics to discuss and both the topics were very dear to me and very important as well. The first topic was about heart failure and the device management. Heart failure, as dear friends, all of you will agree that it has reached an epidemic proportion, costing several deaths, millions of deaths, years after years. The treatment for heart failure started way back in 1950s, 60s, but then it was not really advancing till the turn of millennium. Now we have fantastic four medical pillars or pharmaceutical, armamentarian treatment, but around the turn of millennium, 2001, 2002, there were only two drugs which we were giving, and then which also did not have very good mortality reduction. So at that time, these devices came into picture, and these devices were what is called as ICD and CRT. What is ICD? Heart failure causes death due to arrhythmias and sudden cardiac death. So ICD will detect the arrhythmia and it will treat by giving instantaneous cardiac shock in the form of just 2 joules, 4 joules, 8 joules, and which will convert the tachycardia back to sinus rhythm. And what is CRT? CRT is cardiac resynchronization therapy. So during this resynchronization, especially if the patient has left bundle branch block, then the entire left ventricular myocardium or the pumping part of the left ventricle, that is dysynchronous, and then that's why it is not pumping well. So with resynchronization, two pacemaker stimuli go to the heart, to the right side and the left side of the heart, and then they make simultaneous electrical stimulation of the heart, and which will achieve this very good result in terms of pumping. So that is CRT. So these two devices were in the forefront, and apart from that there were various other devices also, because heart failure produces dilatation of the heart, and that produces secondary or functional mitral regurgitation, and this mitral regurgitation increases the further dilatation of the heart, increases the ventricular size, and what is called as MR begets MR, failure begets more MR, and then there is a vicious cycle. So just by putting another device, what is called as mitra clip, you can just clip the mitral wall with the help of your catheter based treatment, and then you can reduce this mitral regurgitation, and then this was proved very well in what is called as COAPT trial. And then subsequently in this 2023 in American College of Cardiology, or ACC 2023 with World Congress of Cardiology, there was further extended results of this COAPT trial which were shown. This mitra clip works very well. Apart from that, there are various other devices also, but then they are still equipoised results, so I will not deal with much. And then second important topic which I dealt with was about venous thromboembolism, and then the agents, the pharmaceutical agents, that is anticoagulants, which we have currently in last 12 years, which have in our Indian armamentarium, so which one to select. And in that again it is very important, because all the three drugs which are internationally very famous are available in Indian pharmacies, and then they have become very affordable. Previously we used to use what is called as vitamin K antagonist to prevent clotting in the veins, and this clot can migrate in the lungs and produce pulmonary embolism and can cause life, and then which accounts for almost 3 million deaths every year all over the globe, and more than 500,000 deaths in Europe itself. So it is a very highly prevalent, highly fatal disease, pulmonary thromboembolism or venous thromboembolism, and for that we need a treatment, and which previously we used to give vitamin K antagonist, which have very high bleeding capabilities and complication rate, which can be in the brain, intracranial hemorrhage, which can be in the stomach, that is gastric hemorrhages, and which can be fatal major hemorrhage also. As opposed to that, these new agents which I harped upon, which should be used in our Indian practice, those are called as direct oral anticoagulant or DOACs, or non-vitamin K oral anticoagulants, NOACs, and amongst that the various drugs were compared using different trials which are available in our literature, and amongst that apixaban turned out to be the best when the meta-analysis of all the drugs which were used. And then subsequently by another speaker, when he discussed about atrial fibrillation and prevention of stroke, and then which anticoagulant to be used in this group of DOACs, so he also emphasized about the use of apixaban. So I think there was a unanimous decision between the two speakers, and that was my second lecture, which I would give as a take-home message, that DOACs are far better than our previous old oral anticoagulant treatment, and amongst the DOACs apixaban is the best. Thank you very much indeed.